I was going to ask you a question. All of you, any of you. Do you want the most efficient and effective and cost-effective health service universally provided in the world? Yes. Is that what you want?
Yes.
Individually and collectively?
Yes.
Are you prepared to support that health service?
Yes.
And those that work in it?
Yes.
The doctors and the nurses and the ancillary workers?
Yes.
Our NHS is extremely effective. Our local NHS at St Helier has one of the lowest rates of mortality. We are very effective in certain areas, for example, acute abdomens and our laparotomy rates, one of the best in the country. We have the best neck of femur system in the country. I have looked at the audit, looked at the mortality. It is the same as it was 3 or 4 years ago, if not slightly better. A quarter of the people dying in St Helier Hospital are over the age of 90.
Wow.
The average age is 80. We are now, as we were 4 years ago, safe at nights and at weekends. And 4 years ago, according to Dr. Foster, we were one of 8 trusts in the country that was safe at night and weekends. Half the people that die in our hospital have only had one admission, their final admission in that year. We are not paying more per capita for care in those over the age of 80 compared to those between 60 and 80. Yes, the elderly are more expensive because there are more of them, but not necessarily per capita. And we are extremely efficient and effective in the way that we use our A&E services, our urgent care services, our outpatient services, our day case services, from the hospital point of view. And that, in fact, is keeping people out of hospital. We're told that you shouldn't go to A&E. People go to A&E when they feel they need to be there. We're told that 30 or 40% going to A&Es generally don't go away with anything, don't change the treatment. They go away with reassurance. They're told that they don't need to come into hospital. The GPs are helped out. And in some areas that I will need to look at in more detail, we are pushing the treatment to the biological limit. You are getting the best services in many areas that you could possibly get according to current practice. That is what we should be concentrating on. It is up to you, and it is up to the medical and nursing professions, and it is up to the ancillary workers in our hospital, who constitute half, or just over half, of the people that are working in the NHS, to fight for this service. It doesn't just happen because United Health or Circle come in from America. You've been told in great detail how it doesn't happen except for the low-hanging fruit, the easy wins, the profitable aspects of care. But our National Health Service is there for you to provide this service, good health care, not for profit. Why should your money, your taxes, go into the necessary NHS services and also a little bit of profit for private health care. We are at the limit. Watch the news. Look at our A&Es throughout the country. We are pushing the service to the limit. There is no room for privatisation and profit and this enormous bureaucracy increasing. I think the Americans spend 30% of the healthcare budget on bureaucracy to sort out the privatisation aspects. We don't need that. It is not true either, as Bob Gill has just said, that just because we've got an elderly population, where the average age over the history of the NHS has increased by about 20 years, a good thing, that the period of dependency, which as is explained is at the end of your life, has necessarily got longer. No, it hasn't. You are living longer because you are fitter and better cared for, and that dependency period, which any population will have at the end of your life, is getting shorter. And only about a fifth of people at the end of their lives actually have high dependency. So even there we're doing very well. So I wish the politicians wouldn't blame it on you, the patients, and particularly on the elderly. So what I am saying, and what you have had in great detail, is a load of mythology. You have got the best health service that you could possibly have. The Commonwealth Fund backs that up. If you want a good American-style health service, I have a lot of American friends. They can't do it as well as we can. It costs 2 to 3 times the amount, the cost, that we do it for over here. And they only cover 80% of their population. So if you want a good health service, you must tell the politicians to repeal the Health and Social Care Act 2012, get rid of the privatisation, the creeping privatisation within the health service, within our hospitals, within our general practices, and also in our social care, which is largely private, and tell them unambiguously that our health service didn't just happen in July 1948 and has not required any particular effort on the part of the medical and nursing professions. No, it is something that we believe in, that we worked for, that we have progressed in terms of our teaching, our training, our research, and our clinical practice. This is what we want, and it seems to me that it is a very simple question. Do you want your health service? Because the answer, it seems to me, is yes.